All right, so today we're going deep into Swedish public health. Specifically, this program called Hälsotorg, or as I've learned to pronounce it, health squares.
That's pretty close. Yeah.
Okay, good. So you give me a bunch of research on this, including some pretty critical analysis.
Mhm.
And I got to say, it's fascinating stuff.
Well, it's a really interesting case study, I think. Partly because it came about at a time when Sweden, like a lot of Western countries, was facing this sort of perfect storm of rising healthcare costs and a surge in all these lifestyle-related diseases.
So basically, the Swedish government was like, okay, we need to get ahead of this thing.
Yeah, exactly. They were looking for ways to empower individuals to take more responsibility for their own well-being,
Yeah.
which could potentially reduce the burden on the healthcare system.
Makes sense. But I got to ask,
Mm-hmm.
this partnership between the Swedish County Councils and Apoteket AB,
Mm-hmm.
this state-owned pharmacy company, that's a little bit of a head-scratcher.
It definitely raises some questions. You have this public health initiative that's all about improving the health of the population, but it's intertwined with a company that makes money from selling medication.
Yeah, talk about a potential conflict of interest.
Right. And the analysis we're looking at really digs into this tension. Was Epitech AB truly invested in public health? Or was this just a clever way to boost their bottom line?
Okay, so red flag number one.
Mm-hmm.
But before we get too deep into that, let's back up a bit. What exactly was Hälsotorg trying to achieve?
So their main goal was to raise awareness about health and encourage people to be more proactive in managing their own well-being. So they set up these health squares all over Sweden, offering things like health counseling, blood pressure checks, educational materials, that sort of thing.
Sounds pretty comprehensive.
Yeah.
But the analysis you sent me, it kind of suggests that this approach was a bit flawed, right?
Yeah, there were definitely some issues. One of the biggest ones was that they didn't really do a thorough needs assessment before launching the program.
So they were basically prescribing medicine without even examining the patient.
That's a great analogy. And to make matters worse, there wasn't a robust system in place to evaluate the program's effectiveness. So while there might have been some positive anecdotal outcomes, it's hard to say for sure whether Hälsotorg actually moved the needle on things like, reducing disease rates or improving overall health.
Okay, so 2 strikes already. No clear understanding of what communities actually needed and no way to measure if they were making a difference. But let's get back to Apoteket AD for a second. What exactly was their role in all of this?
Well, they were heavily involved. They provided a lot of the resources for the health squares, including those counseling services you mentioned. And their annual sales figures, they're pretty impressive, which suggests that they were a major player in the Swedish healthcare market at the time.
So was their involvement in Hälsotorg genuine? Or were they just trying to cash in on a public health initiative?
That's the million kroner question, isn't it? The analysis brings this up again and again. Were they truly committed to public health, or is this just a clever marketing ploy to increase sales?
Tough to say for sure without more information. But it definitely raises some eyebrows. I mean, this whole idea of a pharmacy company being at the forefront of a health promotion initiative, it's a bit like the fox guarding the henhouse, don't you think?
Uh-huh. Yeah, that's a striking image. And it really captures the tension at play here. On one hand, you have this potential for good, making health information and resources more accessible. But on the other hand, you have this underlying profit motive that kind of casts a shadow over everything.
Right. So we've established that Hälsotorg had some structural issues and this kind of questionable partnership with Apoteket AB.
Yeah.
But what about the content of the program itself? The analysis talks about this concept of the determinants of health. Can you explain what that means and how Hälsotorg addressed these determinants?
Sure. So the determinants of health, it's basically a fancy way of saying all the factors that influence our well-being. And it goes way beyond just individual choices. We're talking about income, education, environment, social support networks, even genetics.
So you're saying your zip code can be just as important as your genetic code when it comes to health?
Exactly. And the analysis argues that while Hälsotorg was well-intentioned, it may not have fully grasped the complexity of these determinants. They focused a lot on providing information, which is important, don't get me wrong. But did they really equip people with the tools and resources they needed to overcome those bigger systemic barriers?
Right, because it's one thing to tell someone to eat healthy, but it's a whole different ballgame if they live in a food desert or can't afford fresh produce.
Precisely. And the analysis suggests that Hälsotorg could have been more effective if they had focused on addressing those root causes of health inequalities rather than just providing information about healthy choices.
So while they were handing out pamphlets on healthy eating, they weren't necessarily addressing the fact that some people can't even access healthy food.
That's one way to put it. And this brings us to another critical aspect that Hälsotorg seems to have overlooked the power of community. Did they really involve the community in shaping the program or leverage existing social support networks to amplify their message?
That's a great point. It seems like they missed a huge opportunity to really empower communities to take ownership of their health.
Yeah, I think so too. The analysis really highlights this as a major missed opportunity. They had some collaborations with local organizations, sure, but it wasn't a core part of their strategy. They didn't fully embrace the idea of community development or mobilize social capital in a meaningful way.
So they were trying to impose solutions from the top down rather than nurturing a groundswell of community-driven change.
That seems to be the case, and I think this oversight contributed to some of the program's other shortcomings, like the lack of a needs assessment and the ineffective evaluation. It's all connected.
Yeah. Right, it's like trying to build a house without a foundation. You need that strong community base to support lasting change. But let's talk a bit more about Apotheket AB, the pharmacy company. We've talked about the potential conflict of interest, but what else do we know about their involvement?
Well, their main business, as we said, was offering a whole range of healthcare products and services. Pharmaceuticals, of course, but also counseling services, blood pressure monitors, things like that.
So they weren't just your typical corner drugstore. They were a major player in the Swedish healthcare landscape.
Absolutely. They had a significant presence, and they were very vocal about their aspirations to be a leading force in the future of healthcare. In fact, they even stated a goal of inspiring people to live healthier lives.
Which, on the surface, sounds aligned with the goals of Hälsotorg. But of course, as we've discussed, we have to consider that their ultimate goal is profit.
Precisely. And the numbers speak for themselves. In 2009, they reported revenue of over 43 billion Swedish krona.
Whoa, that's a lot of krona. Okay, so they were clearly doing well as a business, but did their involvement in Hälsotorg extend beyond Sweden's borders?
That's an interesting question. While Apoteket AB did operate internationally under the brand name Apoteket Pharmacare, the information we have really focuses on Hälsotorg's implementation within Sweden. So it's unclear whether they had plans to export this model to other countries.
Huh. Another potential missed opportunity, maybe? But let's get back to those determinants of health for a minute. The analysis goes into detail about how Hälsotorg addressed each one, revealing both some hits and misses. Why don't we unpack those, starting with, income and social status?
Great idea. The connection between income and health, it was definitely on the radar of Swedish policymakers. They recognize that healthcare costs go up and people have more health issues, and they tried to address this through Hälsotorg by, making health information widely available for free.
Sounds promising, but I'm guessing there was a catch.
You bet. Despite this focus on free access to information, Apoteket AB still found ways to profit. The influx of people seeking resources, it likely translated into sales of other products or services.
So it's like, here's some free information, but hey, while you're here, check out our amazing selection of, vitamins and supplements.
Something like that, yeah. So a bit of a mixed message there. What about social disparities? Did Hälsotorg effectively address those?
That's a good question.
Well, not really, unfortunately. The analysis is pretty critical of Hälsotorg for, not really implementing any substantial measures to tackle the existing social disparities, which are a key driver of health inequality.
Yeah, they were providing information, but not addressing the root causes of those disparities, kind of like putting a Band-Aid on a broken bone.
Powerful analogy. It really highlights the limitations of their approach. They were addressing the symptoms to some extent, but not the underlying condition.
Okay, let's move on to the next determinant then, education. How did Hälsotorg approach that one?
So their main focus there was on accessibility. Making health information readily available, easy to find, easy to understand. However, the analysis criticizes them for maybe mistaking the simple provision of informational materials for actual education. Just handing out pamphlets and brochures, it's unlikely to have a significant impact on the population's health literacy.
Right, because simply handing out pamphlets isn't enough to foster true understanding and empower people to make informed decisions about their health.
Exactly. True health education, it goes beyond just providing information. It's about equipping people with the knowledge and the skills to critically evaluate information, navigate the healthcare system, and advocate for their own well-being.
So it's about teaching people how to fish, not just giving them a fish. Did Hälsotorg offer any programs or services that went beyond simply providing information?
Well, they did offer some coaching services, but those were part of their paid offerings, which created a potential barrier for the people who might have needed them the most. Individuals with lower incomes or limited health literacy.
That seems a bit counterproductive, doesn't it? If you're aiming to promote health equity, Shouldn't those essential services be accessible to everyone?
Absolutely. And the analysis also points out that Hälsotorg missed an opportunity to, align their initiatives with broader educational goals like the ones outlined in the Millennium Development Goals, for example.
So it's like they were operating in a silo rather than seeing themselves as part of a larger ecosystem of organizations and initiatives, all working towards this common goal of improving health.
Right, exactly. Okay, so let's move on to the environmental determinant of health. How did Hälsotorg take that into consideration?
Yeah, because that's a big one, right?
Huge. And to their credit, they did acknowledge the importance of a supportive environment for health, which is a good starting point.
Yeah.
And they also benefited from having both local and national policy support, which is essential for creating environments that, actually promote well-being.
So they had the policy framework in place. But how did that translate into concrete actions to improve the physical environment? Like, were they building parks or bike paths or, things like that?
That's where things get a bit fuzzy. The analysis notes that Hälsotorg didn't explicitly prioritize things like, improving access to physical activity or creating green spaces. They did provide some information and opportunities for healthy choices, sure, but they didn't really go the extra mile to create an environment that naturally nudged people towards healthier habits.
So supportive in a broad sense, but maybe not as proactive as they could have been in, actually shaping the physical environment to make those healthy choices the easier choices.
Exactly. They missed an opportunity to really integrate environmental considerations into their approach in a more concrete way. What about social support networks? We know those are super important for health and well-being. Did Hälsotorg tap into that at all?
It seems like they might have dropped the ball on that one too, right?
Yeah, to some extent. They acknowledge the importance of a holistic approach to health, which includes social support. But their efforts in this area were pretty limited. They did collaborate with schools, councils, workplaces, things like that. But these partnerships weren't really deeply integrated into their core strategy.
So they were dipping their toes into the social support pool, but not really diving in.
Uh-huh. Yeah, that's a good way to put it. The analysis argues that they could have been much more strategic in leveraging social capital and, cultivating a sense of community around health.
It's like they were missing that key ingredient, that feeling of connection and belonging that can be so powerful when it comes to making positive changes in your life.
Absolutely. And the analysis specifically points out that they didn't really effectively address complex conditions like obesity, which often have strong social and psychological dimensions.
So they were providing information about healthy eating and exercise, but not necessarily addressing the emotional and social factors that might contribute to overeating or a lack of physical activity.
Exactly. Their approach was missing that crucial whole person perspective.
All right, let's move on to the next determinant, the cultural one. How did Hälsotorg navigate this often complex terrain?
Well, the analysis suggests that they might have fallen short in this area as well. There's this emphasis on, promoting consistency through policy, which could have made it difficult to tailor their approaches to different cultural customs or traditions.
So a bit of a one-size-fits-all approach that might not have resonated with everyone.
That's a valid concern. And the analysis notes that, social class and status are often linked to thinking habits, which can have a significant impact on health behaviors. So if you're not addressing those deeply ingrained cultural beliefs and habits, you're fighting an uphill battle.
It's like trying to plant a flower in concrete. You need to prepare the soil first.
Exactly. Cultural sensitivity and responsiveness, they're essential for effective health promotion.
Okay, now let's tackle genetics. That's one determinant of health we can't really change, right?
Unless you're, a mad scientist or something. Haha.
Right. Well, to some extent, that's true. But the analysis points out that Hälsotorg missed an opportunity to, incorporate some preventative measures like screenings that could utilize genetics to identify potential health risks.
So while they were focused on lifestyle changes, they weren't necessarily leveraging genetic information to personalize preventative care.
That seems to be the case. The analysis highlights the fact that nearly every disease has some genetic component, so considering those factors could have been hugely beneficial.
Okay, so it's not about changing your genes, but about understanding how your genes might influence your health risks and then tailoring preventative measures accordingly. Makes sense.
Exactly. All right, moving on to personal behavior and coping skills.
Hmm.
This seems like an area where Hälsotorg would have excelled, right? I mean, they provided a ton of information about healthy eating, exercise, stress management, all that good stuff.
Yeah, you'd think so, right? Well, it was definitely a major focus,
Yeah.
and it aligned with the Swedish public health objective bill at the time. However, the analysis suggests that simply providing information might not be enough to actually promote lasting behavior change.
So we're back to that idea of, teaching skills rather than just imparting knowledge.
Exactly. People need support and guidance to develop healthy habits and coping mechanisms. It's not enough to just tell them what to do. You have to show them how to do it and provide ongoing support along the way.
It's like learning a new language. You can read all the grammar books you want, but you're not going to become fluent until you actually start speaking and practicing regularly.
Perfect analogy. It highlights the importance of, practical application and ongoing support. Okay, last but not least, let's talk about the health services determinant. Hälsotorg was designed to improve access to these services, right?
That was the whole point, wasn't it?
Yeah, that was a primary goal. The health squares were intended to, make health information counseling and other services more accessible to the public. And the government was clearly committed to expanding access, with 26 health squares already up and running and plans for another 25. But did they consider gender differences when they were designing these services?
That's a good question.
Yeah.
I mean, men and women often have different health needs and concerns, so it seems like that would be an important factor to consider.
Absolutely.
Yeah.
And the analysis we have, it doesn't explicitly mention whether Hälsotorg offered any gender-sensitive information or services, which could be another area for improvement.
Yeah, it's like designing a car without considering the height of the driver. You need to tailor your approach to the specific needs of the population you're serving.
Exactly. And failing to consider those gender differences, it could result in programs that, inadvertently exclude or marginalize certain groups. So it's important to be mindful of those nuances.
Okay, so we've thoroughly dissected the determinants of health and how Hälsotorg addressed or failed to address each one. It seems like they had a mixed bag of results with some areas of strength and some pretty glaring weaknesses.
I think that's a fair assessment. They had a decent foundation, but could have been far more comprehensive and nuanced in their approach.
Right, so we've talked about what Hälsotorg did, or at least attempted to do, but let's shift gears for a moment and delve into the theoretical underpinnings of this program. What were the guiding principles behind their approach to health promotion?
That's a crucial question. Hälsotorg was built upon several theories and concepts, and understanding those can really help us grasp both the strengths and the limitations of their strategy. For example, they drew heavily from environmental perspectives, recognizing the importance of creating supportive environments that enable healthy choices.
Which makes sense, given their focus on, making health services easily accessible. It's about meeting people where they are.
Exactly. But their approach also incorporated elements of, the biomedical model with an emphasis on, preventing disease and promoting individual responsibility.
So kind of a mix of let's change the environment and let's change individual behavior.
Exactly. And while this dual approach isn't necessarily a bad thing, it can create tension if it's not carefully balanced.
Right, because you can't just tell people to eat healthy if they live in a food desert or can't afford fresh produce. It's about addressing those systemic barriers as well.
Absolutely. And the analysis points out another significant omission. They didn't really embrace community development as a core strategy.
Which is something we touched on earlier, right? It's about empowering communities to take ownership of their health
Yep.
rather than just, delivering top-down solutions.
Exactly. And while Hälsotorg did incorporate some elements of capacity building, like providing knowledge training practitioners, building partnerships, that sort of thing, they didn't fully leverage the power of community mobilization.
So they were building individual capacity, but not necessarily community capacity.
That's a critical distinction. And I think this lack of community focus might explain why they struggled to address those broader social determinants of health effectively.
It's like trying to build a house without a solid foundation. You need that strong community base to support any kind of lasting change. So what other theoretical models could they have drawn upon?
Well, there's the Tannehill model, which emphasizes, the interplay of health education prevention and health protection.
So it's about informing people, protecting them from harm, and equipping them with the skills to make healthy choices.
Exactly. And Hälsotorg addressed some of those elements, but perhaps not as comprehensively as they could have. Another relevant model is, the empowerment model, which aligns with their focus on improving access to information.
Right, because Hälsotorg seemed to recognize that knowledge is power when it comes to health. But as we discussed earlier, it's not just about providing information, it's about empowering people to actually use that information effectively, to navigate the complexities of the healthcare system, and advocate for their own needs.
That's a great point. And the analysis also mentions the social ecological model, which, takes into account the complex interplay of cultural, economic, and social factors that influence health.
So that it takes a village idea again.
Exactly. And while Hälsotorg acknowledged these factors in theory, they didn't always translate that understanding into practice.
It's like they were trying to fit a square peg into a round hole sometimes.
Mhm.
They had some good ideas, but didn't always have the right tools or frameworks to actually implement them effectively.
Right.
What other models are out there?
Well, the analysis also mentions the salutogenic model, which you might have heard of.
I think so. It focuses on promoting health and well-being rather than just preventing disease.
Yeah, exactly.
Yeah.
It emphasizes, understanding people's perceptions of health and tailoring interventions accordingly.
So it's about listening to people's lived experiences and meeting them where they are rather than just, imposing solutions from the top down.
Precisely. And finally, the analysis touches on the importance of reflective practice, which encourages professionals to, critically examine their own beliefs and approaches.
So it's about being open to learning, adapting, and continuously improving.
Absolutely. And it seems like this element might have been missing in the Hälsotorg program, which is unfortunate because, you can always learn and grow even from your mistakes.
Well, speaking of mistakes, let's shift gears and talk about one of the most glaring omissions in the Hälsotorg program, the lack of a robust evaluation system.
Oh, yeah, that was a big one. The analysis really hammers on that point. It's like throwing a party and not even bothering to count how many people showed up or if they even had a good time.
Right. How can you possibly know if you succeeded if you don't measure your results?
Exactly. And this lack of evaluation makes it incredibly difficult to, determine whether Hälsotorg actually achieved its goals of, improving population health and promoting self-care.
It's like driving a car without a speedometer. You might be moving, but you have absolutely no idea how fast or in what direction.
Perfect analogy. And the analysis suggests that this lack of evaluation was a missed opportunity on multiple levels. For one thing, a thorough evaluation could have provided valuable insights into, the public's understanding of those determinants of health we talked about.
So they could have gotten a better sense of how people perceive those various factors that influence their well-being and use that knowledge to tailor their interventions more effectively.
Exactly. It's about understanding your audience before you start crafting your message. And an evaluation could have also helped them figure out, which aspects of the program were working well and which ones needed improvement.
So it's not just about measuring overall success or failure. It's about collecting data that can be used to, inform ongoing refinement and optimization. It's about
Right.
continuous improvement.
Absolutely. And evidence-based health promotion, it hinges on this kind of data. Without that evidence, you're just shooting in the dark.
So they were collecting some data, but it wasn't necessarily comparable to other programs or initiatives, which
Yeah.
makes it really hard to, assess their effectiveness in a broader context.
Right. And the analysis highlights this as a major oversight. It's like they were playing a different game than everyone else, which makes it, impossible to really judge their performance.
Makes sense. So they were missing out on valuable data that could help them improve their program and, demonstrate their impact to policymakers.
Exactly. And the analysis goes on to say that a proper evaluation could have also provided valuable information to those policymakers, helping them make more informed decisions about, resource allocation and future investments.
So it's about justifying the expense
Mm.
and demonstrating a return on investment. Without that data, it's hard to make a strong case for continued funding or program expansion.
It's like going to your boss and asking for a raise without being able to show how your work has benefited the company.
Ouch. Yeah, that's not going to fly. And the analysis also argues that, evaluation is essential for building public trust and support for health promotion initiatives.
Absolutely. Transparency is key. People are more likely to buy into a program if they can see that it's actually working, When you're open about your methods and your results, you're more likely to gain buy-in from the community.
So the lack of evaluation wasn't just a scientific oversight. It was a strategic blunder. It undermined the credibility of the program and limited its potential impact.
Couldn't have put it better myself.
Okay, so we've thoroughly dissected the importance of evaluation, but the analysis also expresses some concerns about, the specific services offered by Hälsotorg. So let's dig into those a bit further, shall we?
Sure. What caught your eye?
Well, one thing that jumped out at me was, the lack of emphasis on mental health services, We all know that mental health is just as important as physical health, yet it seems like Hälsotorg didn't really address this aspect of well-being.
You're right. The analysis doesn't mention any mental health services being offered through Hälsotorg, which is a pretty significant omission given, how widespread mental health issues are. It's like going to a mechanic for a car tune-up, and they only check the engine but completely ignore the brakes, the tires, everything else.
Uh-huh. Yeah, that's a good way to put it. Mental health is such an integral part of overall well-being. Neglecting it creates a very incomplete picture of health.
Yeah.
What about community involvement? Did Hälsotorg effectively involve the community in shaping their program?
That's a great question, and unfortunately the answer seems to be no. The analysis mentions collaborations with local organizations, sure, but there's no indication that the community had a genuine voice in, shaping the program's direction or content. It seems like it was more of a top-down approach with, experts deciding what was best for the community rather than actually asking the community what they needed.
Which, as we've already discussed, often leads to solutions that miss the mark.
Exactly. The analysis suggests that this lack of community involvement might have hindered both the effectiveness and the sustainability of the program. It's like, designing a park without consulting the people who are actually going to be using it.
You need that local knowledge and input to create something that truly meets the needs of the community.
Absolutely. And speaking of needs, the analysis also criticizes Hälsotorg for not adequately addressing health inequalities.
Right, because despite their focus on the social determinants of health, it seems like they didn't have a concrete strategy for actually tackling those systemic barriers that, lead to disparities in health outcomes.
Exactly. They were acknowledging the problem, but not necessarily offering any real solutions.
So they were offering resources, but not addressing the root causes of those disparities.
Yeah.
Kind of like providing crutches to someone with a broken leg without actually setting the bone.
Wow, that's a powerful image. And it really captures the inadequacy of their approach.
Okay, so we've delved into quite a few shortcomings of Hälsotorg. But to be fair, the analysis does acknowledge that the program had some positive aspects.
Yeah.
What were some of the things they got right?
Yeah, despite their flaws, Hälsotorg did show a commitment to, decentralizing responsibility and resources for health promotion.
So they were moving away from that purely top-down model and, empowering local communities to take some ownership.
To a certain extent, yes. And they also had a pretty strong economic foundation, which allowed them to, offer a diverse range of services and resources.
Money talks, as they say.
It certainly helps. And they were also, supported by technology, which enabled them to reach a wider audience and deliver information more efficiently.
So they were leveraging the tools of the time to expand their reach and impact.
Exactly. And the analysis also notes that they had a relatively good track record when it came to child and adolescent health. So they were making progress on some fronts, for sure.
But still, plenty of room for improvement, right?
Yeah. Absolutely. Continuous improvement. It's crucial, especially in the field of public health. We should always be striving to do better, to learn from our mistakes, and to adapt to the ever-changing landscape of health and well-being.
So Hälsotorg, it was a mixed bag of results with both successes and missed opportunities.
That's a fair assessment.
Yeah.
And perhaps the most important takeaway is, the crucial importance of thorough evaluation and a willingness to, adapt and improve based on the data.
Absolutely.
Yeah.
Without that feedback loop, even the most well-intentioned programs can fall short of their goals. And that's something we can all learn from, whether we're working in public health community development or any other field where we're trying to make a positive impact in the world.
Yeah, for sure. It's about recognizing that people are the experts in their own lives,
Absolutely. We can't just come in with our preconceived notions and expect to solve everyone's problems. But it seems like Hälsotorg, despite all their research and analysis, kind of missed the boat on that one.
Yeah, it does appear that way, which is unfortunate because they had so many other things going for them. They had the funding, the infrastructure, the government support, but they didn't really tap into that, that vital energy that comes from true community ownership.
It's like they built this amazing car but forgot to put gas in the tank.
Uh-huh. That's a good one. And it makes you wonder, what if they had taken a different approach? What if they had focused more on, building relationships, empowering local leaders, creating a sense of shared purpose?
Well, the analysis actually touches on a concept that might have helped this idea of social marketing. Can you remind me what that's all about?
Oh, yeah. Social marketing. It's basically applying marketing principles to, promote social good. So in the context of health promotion, it's about understanding your target audience, crafting messages that resonate with them, and using a variety of channels to reach them effectively.
So it's not just about, broadcasting information. It's about tailoring your approach to specific groups and using, persuasive techniques to encourage behavior change.
Exactly. It's about meeting people where they are and appealing to their values, beliefs, motivations, that sort of thing.
So it's kind of like selling a product, but the product is a healthier lifestyle.
Uh-huh. Yeah, you could
Yeah.
say that. And the analysis suggests that Hälsotorg could have benefited from a more sophisticated approach to social marketing.
Okay, I'm intrigued. How so? Give me some examples.
Well, for starters, they could have done more market research to, really understand the specific needs, attitudes, and barriers of different population groups.
So again, it's about knowing your audience.
Exactly. And once they had that understanding, they could have developed, more tailored messages and interventions that were more likely to resonate with those specific groups.
It's about speaking the language of the people you're trying to reach.
Exactly. And they could have also used a wider range of channels to, disseminate their messages. Instead of relying solely on those health squares, they could, I don't know, utilize social media, community events, partnerships with local organizations, that sort of thing.
So it's about being creative and going where the people are rather than expecting them to come to you.
Right. And the analysis also points out that Hälsotorg could have incorporated more, storytelling and emotional appeals into their messaging.
Ah, yes, the power of narrative. Everyone loves a good story.
Absolutely. Stories have this amazing ability to, connect with us on an emotional level,
Hmm.
make information more memorable, and inspire action.
So instead of just presenting like dry facts and figures, they could have shared personal stories of people who had, made positive changes in their lives through Hälsotorg.
Exactly. Or they could have used, I don't know, humor, visuals, other creative techniques to capture attention and, make those messages stick.
It's about making health promotion,
Yeah.
engaging and relatable, not just like preachy and prescriptive.
Exactly. And the analysis suggests that Hälsotorg, with its emphasis on providing information in a, somewhat neutral and detached way, missed an opportunity to really connect with people on a deeper level.
It's the difference between, reading a textbook and watching a compelling documentary. One engages your mind, the other stirs your soul.
I love that analogy. And when it comes to motivating behavior change, we need both, right? We need the information, but we also need that emotional spark that, ignites action.
So Hälsotorg could have been more effective if they had embraced, the power of storytelling and social marketing.
Without a doubt, those tools could have helped them reach a wider audience, create more compelling messages, and ultimately inspire more people to make those positive changes.
It's like they had all the ingredients for this delicious meal, but forgot to add the seasoning. It might be nutritious, but it's not going to be very appetizing.
Uh-huh. That's a great way to put it. And it highlights the importance of, considering all aspects of health promotion, from the theoretical underpinnings to the practical implementation. We need to have a solid foundation, but we also need to be, creative, engaging, and responsive to the needs of our target audience.
So it's this delicate dance between science and art logic and emotion information and inspiration.
Precisely. And when we get that balance right, we can create health promotion initiatives that are truly transformative, that have the power to really make a difference.
Okay, so we've talked about what Hälsotorg got right, what they could have done better, and the importance of things like, community engagement and social marketing.
Yeah.
But let's zoom out for a second and consider the broader context of, public health in Sweden. What can we learn from their approach?
Well, one thing that really stands out is their commitment to a socialized healthcare system. They truly believe that everyone deserves access to quality healthcare regardless of their income or social status.
Which is pretty different from the system we have here in the U.S., where healthcare is often treated as a privilege, not a right.
Yeah, it's a completely different mindset. And that fundamental difference in philosophy, it shapes everything from their approach to health promotion to how they allocate resources.
So it's not just about specific programs like Hälsotorg, it's about that underlying belief in the importance of collective well-being.
Exactly. And that commitment to social welfare, it goes beyond just healthcare. They have, strong social safety nets, generous parental leave policies, a real emphasis on work-life balance.
Well, it's about creating a society that supports people at every stage of life, not just when they're sick or in need.
Exactly. And this approach seems to be working for them. I mean, Sweden consistently ranks among, the healthiest and happiest countries in the world.
So maybe they're onto something with this whole taking care of each other thing.
It certainly seems that way. And while no system is perfect, theirs offers a really compelling example of, what's possible when a society truly prioritizes the well-being of all its citizens.
It's a good reminder that we don't have to accept the status quo. We can choose to create a world where health and happiness aren't just for the privileged few, but for everyone.
Couldn't agree more. And by, studying the successes and the challenges of countries like Sweden, we can learn so much about, how to build a more equitable and just society one where everyone has the opportunity to thrive. It's about expanding our horizons and recognizing that there are many different paths to well-being. We don't have to reinvent the wheel, but we can definitely learn from those who are already doing things differently and maybe doing them better.
Absolutely. And speaking of doing things differently, let's shift gears for a moment and talk about another key takeaway from the Hälsotorg analysis, the importance of, understanding those diverse perspectives and beliefs that people hold about health.
Yeah, that's where things can get a little, I don't know, messy, right? Everyone has their own unique set of, experiences, values, cultural influences that shape their views on health and well-being.
Right. And the analysis points out that Hälsotorg, with its emphasis on providing, standardized information and promoting this sort of uniform approach to health, might have overlooked this really crucial aspect.
So we're back to that one-size-fits-all approach that we know doesn't always work.
Exactly. The analysis suggests that health promotion initiatives need to be more nuanced, more culturally sensitive. They need to, recognize that what works for one person or one group, it might not work for another. It's about respecting those differences and tailoring our approaches accordingly.
Precisely. And that requires us to be, good listeners. We need to engage in meaningful dialogue with communities, understand their perspectives, and co-create solutions that, actually resonate with their lived experiences.
So it's about moving away from that expert knows best mentality and embracing a more collaborative approach.
Absolutely. And the analysis also highlights the importance of acknowledging, those power dynamics that can exist in these interactions. We need to be mindful of our own biases and assumptions and, create space for those who have been traditionally marginalized or excluded.
So it's not just about being culturally sensitive, it's about being socially just.
Precisely. And the analysis suggests that Hälsotorg, despite their good intentions, might have fallen short in this area. They really emphasized providing information and promoting individual responsibility. But they didn't necessarily create structures or systems that, addressed those underlying power imbalances.
So they were promoting equality in theory, but maybe not in practice.
That seems to be the case. And the analysis reminds us that, true health equity, it requires more than just providing access to resources. It requires us to actively dismantle those systemic barriers that perpetuate disparities and create a society where everyone has the opportunity to reach their full potential.
It's about leveling the playing field, not just pretending that it's already leveled.
Exactly. And this requires us to be critical thinkers. We need to question our assumptions, challenge the status quo, and be willing to, deconstruct those systems and structures that perpetuate injustice.
So it's not enough to just have good intentions. We need to be actively engaged in dismantling those systems of oppression.
Absolutely. And that work, it's ongoing. It requires constant vigilance, self-reflection, and a willingness to, learn and grow.
It's about being comfortable with being uncomfortable, recognizing that, we're all on a journey and being open to making mistakes along the way.
Exactly. And I think that's a powerful message that we can all take away from the Hälsotorg analysis. Even well-intentioned programs can have unintended consequences. We need to be, humble, reflective, and committed to continuous improvement.
So it's not about striving for perfection. It's about striving for progress.
Exactly. And it's about recognizing that the work of, creating a healthier and more just world, it's never truly done. It's an ongoing process that requires our collective effort and commitment.
Right. So we've talked about, the importance of understanding diverse perspectives, addressing power dynamics, and dismantling those systems of oppression. But let's bring it back to something a little more, concrete for a second. The analysis mentions the role of the media in, shaping public perceptions of health. What are your thoughts on that?
Ooh, that's a big one. The media, it definitely plays a huge role in shaping our understanding of, health and illness. It can influence our perceptions of risk, our attitudes towards different behaviors, even our access to information.
So it's not just about reporting the news, it's about framing the narrative.
Exactly. The way the media chooses to portray certain health issues, it can have a profound impact on, how we think about those issues. And the analysis suggests that Hälsotorg might have underestimated the power of the media.
Oh, interesting. How so?
Well, for one thing, they could have been more proactive in, engaging with the media to make sure that their program was being portrayed accurately and effectively.
So it's about managing your public image and getting your message out there in a way that, actually resonates with people.
Exactly. And they could have also been more critical of, the ways in which the media tends to frame certain health issues. For example, the media often focuses on like individual responsibility and lifestyle choices while downplaying those broader social determinants of health that we've been talking about.
It's that whole tendency to, blame the victim,
Right.
right? Like if you're sick, it's because you made bad choices, not because you live in a society that, makes it hard to be healthy.
Exactly. And that kind of framing it can be so harmful. It can lead to shame, stigma, a sense of hopelessness, and it can also distract us from those systemic issues that really need to be addressed.
So it's not just about getting our message out there. It's about, challenging those dominant narratives that, perpetuate inequality and injustice.
Absolutely. And the analysis suggests that health promotion initiatives, they need to be more media savvy. They need to understand how the media works, how to engage with journalists effectively, and how to frame their messages in a way that, really resonates with the public.
So it's about being strategic and using the media as a tool for social change.
Exactly. And it's about recognizing that the media, it's not this neutral entity. It's shaped by, power dynamics, commercial interests. There's a whole bunch of other factors that can influence its reporting.
So we need to be critical consumers of media,
Uh,
but we also need to be like savvy producers of media.
That's a great way to put it. And I think that's another important takeaway from the Hälsotorg analysis. We can't afford to ignore the influence of the media. We need to engage with it, strategically and thoughtfully to make sure that it's promoting health and well-being, not perpetuating, harmful stereotypes and narratives.
So it's about using our voices to, amplify those messages that are aligned with our values and to challenge those that aren't.
Exactly. And it's about recognizing that we all have a role to play in, shaping the public discourse around health, whether we're sharing information on social media, talking to our friends and family, writing letters to the editor, our voices matter.
It's about being active participants in the conversation, not just passive consumers of information.
Precisely. And by using our voices collectively, we can create a more informed, engaged, and empowered public. And that's what health promotion is all about, right? It's about creating a world where everyone has the knowledge, the skills, and the support they need to live healthy and fulfilling lives.
Okay, so we've covered a lot of ground today. We've talked about, the successes and the challenges of Hälsotorg, the importance of community engagement, social marketing, media savvy, and the broader context of public health in Sweden.
It's been a great conversation.
I agree. And I think there's, one more key takeaway that we haven't explicitly mentioned yet, the importance of hope.
Ah, yes. Hope. It's essential. But without hope, it's easy to get overwhelmed by, the complexity of these issues and just give up on the idea of, creating a healthier, more just world.
It's that belief that things can get better, that our efforts matter, and that, a brighter future is possible, even if we can't quite see it yet.
Exactly. And I think the Hälsotorg analysis, despite, its critical tone, it does offer a glimmer of hope. It reminds us that even imperfect programs can have, positive impacts. It shows us that there are people out there who are, truly passionate about making a difference. And it encourages us to keep striving for progress, even when the path ahead seems, long and uncertain.
So it's not about being naive or, ignoring the challenges. It's about holding on to that belief that change is possible.
Absolutely. And I think that's a really powerful message to carry with us as we move forward. Despite all the complexities and obstacles, there's always reason to hope. And with hope as our guide, we can continue working towards a world where everyone has the opportunity to thrive. It really is. It makes you think about, how we define success when it comes to these kinds of initiatives.
Right, because maybe Hälsotorg didn't achieve all of its stated goals,
Mhm.
but it did spark a conversation,
Yeah,
and it got people thinking about these issues in a new way.
absolutely. And it also, it laid the groundwork for future initiatives and hopefully more effective ones.
Yeah, and as we've discussed, they did get some things right.
Yeah.
And I think those successes, however small, are worth celebrating. It's like, even if you don't win the race, you still cross the finish line.
Yeah.
And that's an accomplishment in itself.
Exactly. It's all about, progress, not perfection. And Hälsotorg, it definitely pushed the conversation forward. It challenged those traditional ways of thinking about health, and it forced people to, to confront those uncomfortable truths about, inequality and injustice. And those are important conversations to have.
Absolutely.
Yeah.
So what are some of the key takeaways that we can, carry with us from this deep dive into Hälsotorg?
Well, I think one of the biggest ones is, the importance of that interconnectedness of all those factors that shape our well-being. It's about understanding that, health is not just about individual choices. It's about like creating environments that support healthy habits.
So that whole "it takes a village" concept again.
Exactly. And Hälsotorg also, it really emphasizes the need for a truly holistic approach to health promotion. We can't just focus on physical health or disease prevention. We need to consider like mental, social, emotional well-being, all of it.
It's about treating the whole person, not just the symptoms.
Right. And maybe most importantly, Hälsotorg reminds us that, evaluation, it's not optional. It's essential. We can't just assume that our efforts are, actually making a difference. We need to measure our impact and be willing to, adjust course based on the data.
It's about being accountable, not just well-intentioned.
Exactly. And by learning from both the successes and the failures of programs like Hälsotorg, we can, we can hopefully pave the way for more effective and sustainable solutions in the future.
So it's about using the past to inform the present and, ultimately create a healthier future for everyone.
I like that, using the past to inform the present. Yeah, that's a great way to put it.
So as we wrap up this deep dive into Hälsotorg, it's clear that, public health initiatives, they require this multifaceted approach, one that considers not only individual behaviors, but also those broader, social, economic, and environmental forces that shape our well-being.
Couldn't agree more. We need to move away from that top-down, expert knows best mentality and really empower communities to, take charge of their own health.
So it's about like shifting those power dynamics and recognizing that communities have the wisdom and the capacity to create solutions that, actually work for them.
Absolutely. And I think the Hälsotorg analysis, with its emphasis on community engagement, social marketing, media savvy, it offers some really valuable insights into how we can facilitate that shift.
It's about recognizing that, health is not just an individual responsibility, it's a collective responsibility.
Yeah,
We all have a role to play in creating a healthier and more just world.
I agree. And that includes, being informed, engaged, active participants in the conversation. We need to challenge those, those dominant narratives that perpetuate inequality and injustice and, amplify the voices that are advocating for health and well-being for all.
So let's continue learning, questioning, and striving for a better future. And if you're interested in delving deeper into these topics, I highly recommend checking out the book, Title of Book. It's a fascinating exploration of the history and evolution of public health. And you'll find a link to purchase it on Amazon in the description of this episode.
And for those of you who, want to support our team in, creating more of these thought-provoking deep dives, we'd be incredibly grateful for your donations. You can find a link to donate in the description as well.
Thanks for joining us on this journey through the world of Swedish public health. Until next time, stay curious, stay engaged, and most importantly, stay hopeful.